Hello everyone, this is Christine Nazid with Health Science 336, talking today about tobacco use among college students. Firstly, the overview of the health issue. Smoking combustible cigarettes is not the only harmful way of tobacco use. There are different forms of tobacco such as smokeless tobacco, cigars, cigarettes, vaping, hookahs. Presented is a chart talking about the percentage of students who ever used tobacco and are current users of tobacco. Nicotine. Nicotine is the most addictive and active ingredient in tobacco. Nicotine stimulates receptors in the brain to release dopamine, triggering a pleasure response. Over time, the number of nicotine receptors increase and changes the brain's anatomy. When the person quits tobacco, they cut off the brain's pleasure response because the receptors don't get nicotine, triggering nicotine withdrawal symptoms. According to the CDC, cigarette smoking, which is the most used tobacco method, causes more than 480,000 deaths each year in the United States, which is 1 in 5 deaths. Tobacco use is considered a public health issue because tobacco almost harms every organ in the human body. Tobacco use can cause heart diseases such as stroke and high blood pressure, and can also cause cancer in bladder, blood, colon, rectum, esophagus, kidney, liver, pancreas, stomach, and lung cancer. Also, tobacco use causes 90% of all cancer death, all lung cancer death. In addition, the risk of dying from cigarette smoking has increased over the last 50 years in the United States. Tobacco use can also cause depression and mental health, and can make it harder for women to become pregnant and for men, and affects men's sperm, which will reduce the fertility rate. Tobacco use can affect bone health, making them weaker, and can also affect teeth and gums, which can lead to teeth loss. Tobacco use is a cause of type 2 diabetes. On average, people who use tobacco die 10 years earlier than people who never smoked. In 2019, an estimate of 23.1 million US adults are tobacco users. 8 of every 100 adults aged between 18 to 24 are tobacco users, and nearly 17 of every 100 aged adult from between 25 to 44 years old are tobacco users. According to the US Department of Health and Human Services, research has found that 45% of undergraduate students between the ages of 18 to 25 endorsed using electronic cigarettes at least once in their lifetime, and 12% of these students reported it within the last 12 months. According to the CDC, education affects the percentage of adults use tobacco use rate, meaning the higher education the person has, the less likelihood they would be a tobacco users. According to SAMHSA 2019, research shows that higher state funding on tobacco control programs shows a reduction in daily tobacco use among individuals, and college students are more likely to use tobacco. Next, we will discuss the prevention programs and policies. There are local programs such as CSUN, Smoke-Free Campus, LA Care Health Plan, Smoke-Free Tobacco Cessation Program, American Lung Association, Nicotine Anonymous, Kaiser Permanente Program, Cessation Program, Tobacco Free CA, California Tobacco Control Program, Proposition 99, the Tobacco Tax and Health Protection Act, And the purpose of this proposition is to provide healthcare services for low-income patients served in hospitals, provide healthcare services for low-income patients. Proposition 56, the California Healthcare Research and Preventative Tobacco Tax Act of 2016, which proposes that the tax money would be used to increase the number of physicians trained and working in California. The California Department of Health would create more education, preventative, and treatment programs. Also attached right here is a bunch of cessation programs run right next to us. Please seek help if you are a nicotine user. It's really harmful. And here are my references. Thank you so much. Have a good day.